Good afternoon, everybody. For those who haven't met, my name is Roy Lilly and I fill in the gaps between the important bits. Welcome to our, I'm not quite sure what to call it, workshop, summit, expo, I don't know what it is. But certainly we couldn't have done it without our partnership with 2020 Healthcare and Julia Manning, thank you for that. And of course the Royal Society of Public Health, who've lent us their rather splendid room. And of course our friends at Novartis, who have given us an educational grant. We've assembled a group of speakers who are really leading edge in their own sectors. We've got 9 speakers who will give 9 presentations of about 10 minutes, only 10 minutes, and they will lead some thinking in the areas of their special interest. Because what we're trying to do this afternoon is to prepare a draft for the IHM submission to the Green Paper on government's Green Paper on the future of social care. Move on now to our next speaker, who is actually from our sponsors. So will you all please sit up and look very interested. So it's not just that it's our sponsors, it is that the pharmaceutical industry have a big role to play. Do they remain passive partners delivering the boxes that we all swallow the pills, or do they actually get more involved in the delivery of our care? These are big challenges for pharma and they're big challenges for us. So will you please give a very warm welcome to Hazid Ahmad.
Good afternoon. So I'm the Managing Director and Country President of Novartis UK. And I'd just like to start off by sharing the lens I'm applying to the question of how can pharma contribute towards integrated care. So back in 1928, my grandfather came to the UK, happened to end up in Sunderland, of all places, and he went back to India in 1949. And he spent then the next 20 years telling pretty much anyone who had a pair of ears what a great thing that was happening in the UK around a health and social care system that was being built. It was going to transform society and deliver real value to society. So much so that my own father became a physician, came to the UK, worked as a nephrologist in the NHS for 35 years. My mother worked as a GP for 30 years. I have a niece who is studying medicine right now, who perhaps is looking at healthcare in a slightly different way. So I have a real, genuine interest in healthcare. So that's kind of the more emotive side, more emotive lens that I apply. There's a very pragmatic or maybe negative lens that can be applied when you look at health and social care today. So within the UK, amongst the 65 million or so people we've got, there's about 100,000 people who've received a telegram from the Queen, who have reached the age of 100. It's about half the size of Southend-on-Sea. It's probably half of Southend-on-Sea, quite frankly. That's quite a scary number. What's perhaps more concerning is that there are 10 million people living in the UK today who will likely get to 100 years of age. So we're at this tipping point in society, and there's absolutely no doubt the last 8 years has created a lot of creakiness within our system. But the decisions that we make today in the next 5 years are really going to have a fundamental impact on the next generation in 20 or 25 years of time. So we have a choice to make. And that's going to require true integration, not just integration of budgets, integration hopefully of larger budgets, but real integration of thinking and system working. And it reminds me, I think, when you have a choice like this, there was a great racing driver in the 1950s, a guy called Juan Manuel Fangio. Some of you may have heard of him. Got a nod here at the front. He was once asked, why do you win so many races? And his answer was beautiful. He said, well, whilst other lesser drivers, when they see an incident up ahead, take their foot off the gas, I see it as an opportunity to put my foot to the floor and get that 1 to 2 second advantage. And that's the situation we're in right now. There are many actors within that health and social care spectrum. And we have a choice to make. Do we want to accelerate towards this and drive real system thinking and truly integrate, not just connect aspects of the system? And I do believe that pharma has a role in redefining this hackneyed term partnership. And I'm going to give some examples of how we're doing it today and how we perhaps should do it in the future. So many of the partnerships my company has today are within the NHS, but I think could be extended to social care and indeed into mental health. An example would be in heart failure. So with Chelsea and Westminster Hospital, with the Hospital Trust, we're working with the local CCGs. We've risk stratified an entire population of cardiometabolic patients. And we've identified 850 patients that we're working with. So we're working with the Hospital Trust, and we're bringing the knowledge, the competency they've got to work with primary care, with GPs, with nurses, to better upskill them, give them greater confidence to manage heart failure patients. We're also working with patients to better educate them around how to self-manage at home, how to understand their symptoms better. I'm going to be managing, and already are seeing, reductions in referrals to hospitals as GPs are more comfortable in managing heart failure, but also less A&E admissions. And this is an area where I believe, based on what I've heard today and what I'm going to hear today, I think we need to extend this example to social care as well. Because with this example, I think if we actually measure the data, I've got no doubt that we've got to demonstrate that we can reduce the demand for many social care services that are required for heart failure patients. We're in some pretty advanced talks right now with some progressive geographies which are integrating health and social care around migraine. So in the UK today, 86 million days are lost as a result of migraine. But for those people who suffer migraine, they could lose half a month in darkness effectively as a result of their migraine. So we're working in a couple of geographies in the UK to say how can we better support patients with migraine and bring them out of the dark, back into society and back into kind of productive life. Another example we have is in Oxfordshire. We actually, through our Alcon business, we're actually providing a managed service for cataract surgery. So the trust came to us and had some concerns about the financial risk associated with this particular pathway. We redesigned the pathway with them, and we're now actually providing that managed service. So we're providing cataract surgery, but also the administrative services and the inventory management for this entire service. And within a 6-month period, we've been able to demonstrate a 38% increase in the number of cataract surgeries. That's 38% more folk going through this system, reducing the time it takes them to have cataract surgery, meaning that they can be more productive, restore vision, and obviously reduce the demand for social care services. And probably the last example I'm going to share, which is very much healthcare specific, but I just want to articulate how this is going to require new system thinking, is something called CAR T therapy. Some of you may have heard of CAR T therapy. So this is cell and gene therapy. So we have a CAR T therapy which is licensed in the United States for acute lymphoblastic leukemia amongst children. It will likely be licensed in Europe, Q4 this year, maybe Q1 next year. Just want to paint a picture of how this product actually works. So you actually extract the blood from a child, so let's say a 7-year-old girl, who's been through chemotherapy, maybe a couple of weeks away from dying. That blood is then cryo-frozen and sent to a manufacturing facility, happens to be in Pennsylvania at the moment, where the T cells are reprogrammed with inactive viral vectors. Those T cells then multiply, and the number of bags that are produced is really dependent on the strength of the immune system of the patient. So this is not personalized medicine, it's individualized medicine. That is then refrozen, brought back to the UK, infused back into the patient. And what we see in pediatric acute lymphoblastic leukemia, we're seeing 86% response rates. To date, no patient has ever relapsed. So whilst we can't yet call it a cure, potentially this is curative. This is really amazing innovation that is being brought to society, but at a time where, quite frankly, if you look at the finances, in many ways couldn't have been brought at a more difficult time. But if you take that example that I've just given you, it's going to require the NHS to be part of our manufacturing process. From when that blood is first extracted, that's when the manufacturing process starts. This is something that's never been done within the NHS or many healthcare systems globally. It's going to require a complete different way of partnership and thinking, I think, between industry and the system. And I guess, with all the examples I guess I've looked at today, if you're like on the outside of the tent looking in, which to some degree pharma is considered to be, And I absolutely want to be within the tent. If you're outside the tent, working on these partnerships requires filling in lots of forms, sending emails. There aren't enough opportunities where we get to actually sit together and discuss the problems that exist. And I just want to say that on behalf of the industry, and certainly my company, we are absolutely willing to play a part. We are playing a part, but the real challenge is how can we move beyond the pilots? There are more pilots in this area than there are in the entire global airline industry. How can we really do it at scale and in a meaningful way? Thank you.
Thank you.
I stand next to you because otherwise people are saying, where's that disembodied voice come from? I mean, the nub of what you're saying really is look to Big Pharma as a partner in the delivery of care. Now that's a big step for you, isn't it? That's disease management. It puts a bigger risk on your balance sheet. It puts more staff within your control. I mean, if anybody discovers a pill for dementia, they'll make like a gazillion pounds because we know a week's supply is worth 638 quid because that's what we pay to keep somebody in the care home. So, that's you can only get your money back with that. But I mean, there are a lot of comorbidities. I mean, the Health Foundation report that came out yesterday, I think it was saying that in the last 5 years, the number of people that go into A&E with more than 3 things wrong with them has gone up by a third. So there's lots of comorbidities, lots of products in that line, and the extent to which you could manage frailty within your pharmaceutical pipeline. I mean, is that what we should be saying in our report? Look to pharma. I mean, pharmacists say, "Oh, we want a partnership." The NHS have been saying that for as long as Florence Nightingale. But is it the time for you to mean it?
So I think I can speak on behalf of my own company.
Yeah.
So we are a medicines business. Just so happens that today that medicine is a biopharmaceutical. Many years ago we were an apothecary business. I think we recognise that we live within a world where talk therapy is a form of medicine. A self-help book for depression can be a form of medicine. So I think there's a growing sense that we can look beyond biopharmaceuticals within our medicines business. We also recognise that if you look at the core competencies of what today is a pharmaceutical company, it doesn't lie just in drug discovery, it relies in behavioural change. So we have demonstrated, I think, through the way that we've commercially launched pharmaceutical medicines, that we can be a delivery partner in driving behavioural change. Yeah. And when you look at many of the inefficiencies within the system, it all seems to boil down to behavioural change required on the parts of physicians, nurses, actors within the system, but also behavioural change required on behalf of patients. And that small example I gave you from Chelsea and Westminster, that's what we're doing, it's behavioural change. Yeah. And the medicine isn't a biopharmaceutical,
you've given us some really good examples and food for thought. Thank you very much, and thank you for your kind sponsorship today. Thank you very much.